We're here today with the Community-Based Public Health Caucus at the APHA convention in Philadelphia. Welcome to Kent and Vanessa. Why don't you introduce yourselves and tell us a bit more about yourselves?
So thank you. I'm Dr. Kent Key. I am a past chair of the Community-Based Public Health Caucus and currently act as the national administrator for the caucus.
Hi, I'm Dr. Vanessa Danzine. I'm the past president of the Community-Based Public Health Caucus and the chair for the program planning.
Great. Well, tell me, community-based public health, what's that all about?
So community-based public health is the premise that if we're going to impact positively the health of communities, that community has to be at the table with an equal voice and really driving the process. So our motto is that community lies at the heart of public health.
Wow, that's interesting. So in what ways would you say community is a key determinant? What would you say some of the key determinants of public health are from communities?
Well, the mantra is this. So prior to community-based public health or CBPR, community-based participatory research, community often was not in all the different phases of the research process. So in understanding what the problem is, identifying the problem, coming up with a research question, looking at the research design, what are the methods for collecting the data, how do you analyze the data? Oftentimes, community was not at that table making those decisions. They were just part of recruitment. But what we're saying is that community are experts and they know what works best. So it's best to have them at the table, one, when identifying what the problems are, what the research questions are, and then they have the expertise of knowing what will work and what will not work in community settings. And so that builds a more robust research project with more richer information.
It's very fascinating. Now, of course, one thinks of community, one tends to think first of geographic location, a village. But in the day in which we live, community may have broader or other definitions. Vanessa, why don't you share with us some of the aspects of what community might mean?
Well, community today is very diverse. It can consist of numerous ethnic groups, populations, sectors. So now it's really to integrate all these different communities into one.
Great. In the medical field, about 20 years ago now, I think there was something called community-oriented primary care. In what ways does community-based public health interconnect with that discipline or that practice in medicine?
So now they're calling it more so now precision medicine. And so community is really at the table looking at how are the social determinants of health, what does that intersection with precision medicine look like? So understanding the community context from which individuals' health are impacted, and then kind of putting that in the equation to understand what needs to happen if we're going to write a prescription or a regimen that will be suitable for that individual.
Very interesting. So tell us a bit about some of your scientific sessions and how have they gone here at this year's APHA?
Well, I just came from moderating a particular session where it was focused on the methodology of community-based participatory research. So we had a panel of 4 different organizations from nationally from different states that brought to the table what their creative work is in the community of origin.
Wow, sounds interesting. Now, of course, it's one doesn't necessarily think of public health is beyond the academic or applied model, but it's also fun. This is the annual time everybody gets together and have fun with their colleagues. So what has your caucus been doing? Any dinners, events, dance parties?
Yes, on Sunday, every year, the Community-Based Public Health Caucus, no matter what city we go in with APHA, we hold a community reception and we give unsung hero awards to local CBOs and agencies that are doing outstanding work. So we honored, I think, about 26 community organizations. On Sunday, we were at Mother Bethel Church. So we used the church as the venue. This year, we used different venues at different times. But we used Mother Bethel Church as the venue. We had a reception. And then we also did a learning institute on precision health and community-based public health and that intersection and what we were just speaking about. And another thing that's really key to our caucus is that we were the first caucus at APHA that brought grassroots community members to APHA, and we were the first to create a youth caucus. And when we meant youth, we didn't mean masters or doctoral students. We bring from middle school to high school students. So starting this kind of pipeline to careers in public health.
Yeah, since 2 nights ago, I met with Dr. Castillo Salgado, who's an epidemiologist from Johns Hopkins, and I asked him what is the most important thing that he's focused on in public health, and it was very interesting. With all his data and statistics, he said children.
Yes.
Not even young adults, but children.
Yes.
And he said the children teach public health to the families. So
Yes.
it's very interesting that you're bringing community members into the caucus and into APHA. Tell me a bit more about that.
And to add to that, the Community-Based Public Health Caucus also have a youth council that had been started some time ago.
Yes. So we started, the caucus started in 2000, around 2005 or 6. The delegation from Michigan and North Carolina started bringing every year young people from high school and middle school. And so eventually, the following year in Denver, we actually formalized the first youth council for our caucus, and they've been functioning ever since. And so like this evening, we have a youth roundtable. So all the young people come together and they present on the CBPR projects that they're doing across health outcomes in their respective communities. And then they have their annual business meeting for the youth council after that.
It sounds like a fantastic way of bringing the community into the research process and into the academic thinking as well. What are some of the things your caucus is doing in terms of applying the results of your scientific sessions in local communities? Share a bit more about that.
Okay, sometimes when they have presentations, they're preliminary studies, and they have like learned or studies that have been completed over a period of time, and they bring to the session what the learned experiences were and what the conclusions and recommendations are.
And then we also have learning institutes, and then we have, monthly conference calls and sometimes webinars where we broadly disseminate and highlight what some of those learnings are. And of course, the traditional publications. Now, in true CBPR fashion, whenever we do a manuscript publication, we also do one that's in a community forum. So for example, we have, so if a project is like a faith-based project, like in Flint, what we would do is not only would it go into a peer-reviewed journal, but we would also go into the local CPSA Courier, which is a publication that goes to all the churches. So we make sure that we are disseminating knowledge equally and equitably. And then our young people are like, hey, we want a YouTube channel. We want to do some things that we can share our results to youth, and we want to use the venues that youth engage.
YouTube is a determinant,
yes,
isn't it?
Yes,
indeed, yes. How many members of the caucus are there?
So currently there are over 480 people on the roll. And we always get new people every year. So on average, I think a good 100 to 200 are very active, but on the roll is like 470.
Well, Kent, I see why you brought your publicist. I think you need to go on the late night talk shows.
Thank you.
Great. Anything you'd like to add? Either one of you? Any extra thoughts?
Hopefully this APHA will bring us additional members to the caucus. We welcome everyone. Bring their ideas in.
Yeah.
Great.
And one of the things that we do, though, is we have a mentoring piece. So like Miss Plus and Mrs. Ehil Deloney and the late Loretta Jones and so many others, Lucille Webb, they were all founding members, if you will, of the original group that helped to start the caucus. And many of us, so the W.K. Kellogg Foundation provided scholarships or funding. We gave scholarships to bring community members who otherwise their organization couldn't afford to send them to APHA. And in that, we created a mentorship model. So if you were an existing member and I was a scholarship recipient, they would pair me with you. And you would start mentoring me, because when you come to APHA, it's such a mammoth place, you can get lost really quickly. And so we also created that mentorship piece, which also helped us to mentor upcoming leaders. We have different caucus chairs every year, and then we have different presidents of our National Community-Based Organization Network, which is a working group of the caucus. So we groom leadership through our mentoring process.
Well, fantastic.
Yeah.
It's been really interesting.
Thank you so much.
Thank you so much. Thank
Pleasure.
you for joining us. Thank you.